Could continued use of drugs like Advil and Motrin and Aleve, these so-called anti-inflammatory drugs, actually lead to chronic inflammation? Well, you're about to find out. But stick around because I want to talk about a certain supplement that actually helps resolve inflammation. In one of the most ironic twists of nomenclature in healthcare, I think most people would be surprised to learn that Aleve and Motrin and Advil and these so-called non-steroidal anti-inflammatory drugs, or NSAIDs, actually cause chronic inflammation in most people who take them.
And isn't it ironic? Don't you think?
So yes, these drugs can cause acute and chronic kidney failure and fluid retention and high blood pressure and increased risk of strokes, increased risk of heart attack, increased risk of atrial fibrillation, and they can cause stomach ulcers, and they can cause heartburn, and they can cause GI bleeding and all the rest of that. But that's not what I'm talking about in this particular video. I'm talking about the fact that if you continue to use them, they actually cause chronic inflammation. So if you haven't caught on yet, what I'm getting at is the fact that they're referred to as non-steroidal anti-inflammatory drugs is a bit disingenuous when you consider that longer use of these drugs actually cause more chronic inflammation. In order to understand how they do this, we have to take a look at how the immune system goes through 3 phases of inflammation. So let's say you get an infection. The microbes will continue to propagate, but at the same time, inflammation here in the yellow will also increase to kill off the infection. So the infection goes up, but the infection dies down because inflammation rose up to kill it. So we see here that the infection dies off and inflammation hits its peak. But if inflammation were just allowed to continue indefinitely, that obviously would be really bad. So the cells involved in inflammation actually signal other cells to come in and resolve the inflammation. And that's how things are supposed to work. But we wouldn't be here if things always went the way they were supposed to work. So what's supposed to happen, again, infection happens, inflammatory cells come in, clean up the infection, and then the inflammatory cells signal other cells to come in and resolve the inflammation. Now, I use the example of an infection, but this could also apply to tissue damage. The same thing happens, right? Let's say you roll your ankle and you damage the tissue. When you damage the tissue, those cells will be damaged and they'll spill out their contents, which creates an inflammatory environment. So these inflammatory cells come in, they clean up the debris from the damaged tissue, and then those inflammatory cells signal other cells to come in to resolve the inflammation. Now, in the acute phase, like the short-term phase of an infection or injury, yes, non-steroidal anti-inflammatories do decrease inflammation. But what happens if the level of inflammation is not exuberant enough to signal the inflammation resolving cells to come in and reduce the inflammation? In other words, what if you continue to take non-steroidal anti-inflammatory drugs because you're in chronic pain? Well, 2 things will happen. Well, first of all, remember that it's the inflammatory chemicals that stimulate the resolution phase. So without much inflammation, you don't fire up the resolution chemicals in cells. So if you don't have enough inflammatory cells to stimulate the resolution phase, that would cause inflammation to persist. It wouldn't go away. So you get chronic low-grade inflammation. But also, you wouldn't have enough inflammation to either kill the pathogen in the case of an infection, or in the case of an injury, you wouldn't properly heal the damaged tissue. So this is what happens when people take non-steroidal anti-inflammatory drugs like Aleve and Advil and Motrin. You get poor healing, but you also get chronic low-grade inflammation. And the longer someone takes those drugs, the more likely it is that the resolution phase of inflammation is not going to happen, which means the more likely you are to have chronic inflammation. But also, in addition to not allowing the inflammatory cells to activate the resolution cells and chemicals, non-steroidal anti-inflammatories actually inhibit the cells and chemicals that produce the resolution phase. And this is why in the research, these non-steroidal anti-inflammatories are referred to as, quote, resolution toxic. And I say quote because it's all over the literature. Everywhere you read about non-steroidal anti-inflammatories talking about the 3 phases of inflammation, they're referred to as resolution toxic. In other words, they are toxic to the resolution phase of inflammation, and this results in chronic inflammation. And best illustrated here in this diagram from this paper published in 2023. And you can see in the diagram similar to the one that I just showed, although if I can be so bold, I think mine was a little bit more aesthetically pleasing, but that's okay. So we can see here on the left that we start with this initial tissue injury, but here they label it as edema, but it could be an infection or surgery or trauma. And those cellular processes instigate the inflammatory process, and the inflammatory process instigates the resolution phase. However, when we see the diagram they made below that graph, that the normal processes involve compounds called prostaglandins, leukotrienes, and thromboxane, those trigger resolvins, protectins, merisins, and lipoxins. They're collectively known as Specialized Pro-Resolving Mediators, or SPMs for short. And these SPMs are responsible for the resolution of inflammation, which it ends with tissue regeneration, wound healing, clearance of debris, and clearance of the infection. However, NSAIDs stop that process, which is why they're called resolution toxic. Instead of resolving the inflammation, we get chronic inflammation and all sorts of nasty things like fibrosis, neurodegenerative conditions, cardiovascular conditions, poor wound healing, kidney failure, cancer, and others. And the reality is all these chronic conditions, at the root of it, systemic chronic inflammation. That's the root of a lot of these chronic conditions. Now, if we want to promote the production of these SPMs, these specialized pro-resolving mediators, like lipoxins and resolvins and protectins and merisins, they all are derived from omega-3 fatty acids. In other words, fish oil. And we can see here from this study that EPA and DHA, which are both omega-3 fatty acids from fish oil, are what the SPMs are derived from. Now here's another paper showing, and in a very aesthetic pleasing diagram I might add, on the left we have all these degenerative conditions that are associated with chronic inflammation, and in the middle we can see these specialized pro-resolving mediators are derived from fish oil. And lastly, here's another paper showing that SPMs are made from omega-3 fatty acids, but if we look over to the right, we can see that omega-6 fatty acids, which are abundant in seed oils and others, are pro-inflammatory. So that's it, right? It's easy as that. Just take a bunch of fish oil, everybody's gonna be happy, world peace, everything's great. But no, it's not that easy. There's no such thing as a free lunch, remember? Even if it's a fish free lunch, no such thing as a free lunch. It is actually that easy for some people. Some people, they can just take a bunch of fish oil and turn their health around and everybody's happy. But for a lot of people, it's not that easy. They have a hard time converting the omega-3s, like the fish oil of EPA and DHA, into these SPMs, these specialized pro-resolving mediators. And sometimes it's because they just have such high amounts of inflammation that they have trouble doing it. Sometimes it's genetic factors. Sometimes they have very high levels of omega-6 fatty acids, and the same enzymes that your body uses to process omega-6, a lot of those same enzymes are used to process omega-3, so they compete with each other, right? So you can take omega-3, but if your omega-6 is still high, you're gonna be using the same enzymes to compete for both, so you're gonna have a hard time making these specialized pro-resolving mediators from the DHA and EPA from the fish oil, because a lot of those enzymes are being used for omega-6. So it's just important to test for a lot of these things with some blood work first. So in the near future, as boring as it may seem, I plan on making more of these videos about the 3 phases of inflammation, particularly about inflammation resolution. The proper level of immune response, like the proper level of inflammation, combined with the proper level of inflammation resolution, is so unbelievably important for so many different chronic conditions. And I know a lot of people may never have heard of inflammation resolution and these concepts that we're talking about, but that doesn't make it any less important. So what I'm hoping to do is make these videos so that people have a better understanding of these things, and I can explain it in a way that you can understand. And that way you're gonna have better choices about your health and better choices about your health care. So if you wanna share this to anybody that you think might benefit, that would be great, and I'll see you next time.